Hello and welcome back to the Wildly Thriving channel. Today's guest is Rachel Smith. She is a functional diagnostic nutrition practitioner, and she is the owner of Natural Health Rising, an online functional medicine practice that serves clients worldwide. After putting her own autoimmune disease into remission, she now has helped hundreds of other naturally reverse their symptoms of autoimmune disease, mold illness, and other chronic health challenges. Rachel's unique RISE approach involves utilizing functional medicine lab testing, nutrition, lifestyle changes, nervous system work, healing hidden infections, and detoxing from environmental toxins in order to help clients heal and thrive. She is also a speaker, course creator, and the host of the Natural Health Rising podcast. Holy crap, Rachel, you do a lot, and I'm so intrigued to hear more about your story. Welcome to the show. So glad to have you on.
Thanks for having me on, Miranda.
Absolutely. Okay, so I always like to start off with hearing your story. We pretty much always have some kind of our own suffering that we've been through, whether it was like a gut issue or an autoimmune condition that led us down this path. So just tell the listeners what you went through to get you to this point.
Well, very long story, but it started from when I was born. When I was a little baby, I remember having pneumonia, and just kind of throughout my whole childhood and life, I had reoccurring lung infections, tons of digestive issues, migraines. I remember coming home from school and running to my bedroom and having to turn off all the lights and just be under the blanket because my head would hurt so bad and my stomach would hurt so bad. So there was already something going on. I think a combination of childhood trauma, bad food, inflammatory foods, eating a standard American diet, and lots of other things, the way I was raised. And as I got into my teens, I kind of started to see how diet could start to impact my health. I remember taking out dairy at one point, and I noticed that my athlete's asthma went away. And I was like, oh, that's really interesting. You would think this is where the turning point is, but actually my health wound up getting worse. In my late teens, early 20s, I had just dozens of mystery symptoms: hair falling out, heart palpitations, panic attacks, insomnia, gut issues. And I was seeing so many doctors. Normal story, right? You go to the doctor with all these symptoms, they run your blood work looks fine, they send you on your way. They say it's just anxiety. They say you're too young, way too young to be sick. So I was in that rabbit hole for a while. And while I was doing that, I started doing my own research. So I started reading a lot of holistic health blogs. There was a couple of podcasts at this time. I used to listen to the Tim Ferriss podcast, and I would do all of his biohacks like cold showers, and started meditating and all sorts of different things. And then there was a health podcast that I was listening to, and I started to realize this could be something pretty serious. I got admitted to the hospital one night for heart palpitations. They wound up doing an exploratory heart surgery on me, and they found absolutely nothing wrong with my heart. It was pretty traumatic. And I was like, okay, this is the final straw for me. I am going to follow my gut, follow all the research I've done, and I'm going to go find a functional medicine practitioner who focuses on autoimmunity. So I found that guy. He still was like, yeah, you look really young, and I don't think you're that sick, but I'll do the labs on you. I'll do the tests on you. And what do you know? I have Hashimoto's, which is an autoimmune disease of the thyroid. Makes sense with the hair loss, the heart palpitations, all that stuff. And he actually told me that my markers looked like that of a 60-year-old, like one of his really old, chronically ill patients. So he had done all sorts of different functional labs on me, and he was the one who really got me into all of this stuff. I started changing my diet. I started taking different supplements, and within a matter of months, I would say 40 to 50% of my symptoms went away. And that was just so mind-blowing to me. I had a long way to go with my healing journey, but I left corporate America immediately, went back to school to study biomedical sciences because I was going to actually go to naturopathic medical school, which is what I did wind up doing for a little bit, and then wound up switching over to FDN because COVID was a shit show, and medical school during COVID was terrible. And I'm so grateful that I found FDN, because now since end of 2020, beginning of 2021, I've been able to help people get rid of autoimmune symptoms like I did, because I don't experience any of those symptoms anymore. And I want everybody to be able to experience that healing.
Yeah. And I think that's actually a blessing and a good thing that you didn't go into medical school because I feel like they lead you down the wrong path. I feel like you lose your critical thinking skills. And I feel like when you become a doctor, you have less involvement with your patient. You know what I mean? Like
Mm,
you're not able to actually do that investigative work that we do as FDNs. And I'm so glad that you practice the same modality that I do because our conversation's about to be amazing.
yeah.
So, with the autoimmunity, I want to hear more about your RISE protocol or program and what exactly does that entail?
So the RISE approach, the R stands for root causes, and so that is what you're very familiar with as well, which is starting with these functional labs that conventional medicine is just not looking at. You're not going to find any doctor, any conventional medical doctor who's going to look at these things. Conventional medicine is looking for blood work, looking for disease state markers, while we're looking at what is actually causing your symptoms, and hopefully we see it to prevent you ever getting into those disease states. So those tests might look like gut health tests, so stool samples, hair tissue mineral analysis testing, mycotoxin testing, organic acids testing, and many other things beyond that too, but those are some core ones that I like to look at. The I stands for integrative protocols and implementation of holistic practices. So that's going to include everything from nutrition and exercise and drainage support to nervous system regulation, stress management tools, and everything in between. The S stands for supplementation and support. So we do use really high quality professional grade supplements to help target any sorts of infections, any toxins that we're finding. The support piece I think is super important. If you're just getting handed a list of supplements and a nutrition handout and someone's sending you on your way, one, that's really not enough to move the needle. And two, it's challenging. You have all these symptoms. There's a lot of work that needs to be done. You're going to have a lot of questions. So I like to be there to kind of hold my client's hand through the process through messaging. And then we also do one-on-one calls. And then the E stands for elimination of symptoms, because that's what's going to happen as you go through that plan. So that's like the RISE framework, but I'm happy to dive into more of any of those categories or autoimmunity specifically.
Yeah, let's dive into autoimmunity because I know that's like the premise of everything that you
hmm
teach. And there's a big conversation going on about autoimmune. And there's people that are going the conventional route, the suppressive route, and then there's people that are going the functional route. But I don't feel like a lot of people are hearing this side. So I would like to see or hear about how you actually move the needle with your autoimmune clients.
Yeah. So with autoimmunity, your conventional approach is going to be medications, right? And a lot of those medications, what they're trying to do is just suppress the immune system. Really powerful anti-inflammatory agents like prednisone or other sorts of drugs like methotrexate. And a lot of these are going to leave someone's immune system too suppressed at times, having a lot of side effects as well. So what I do is look for, and not saying that those don't have a time and place. They definitely can. Some people need those for a short period of time. Some people need them for longer. But in functional medicine, there's what's called like the three-legged stool in autoimmunity. And it's genetic predisposition, intestinal permeability, and environmental triggers. So genetic predisposition, there is truth to it, right? Like if your grandma had rheumatoid arthritis, you do have a higher likelihood of getting rheumatoid arthritis. But we know that our genes are not our destiny. So that's like a tiny, tiny piece of the puzzle. Intestinal permeability, this is huge. This is leaky gut or intestinal permeability is found in every single person who has autoimmune issues. So that's why gut testing is so important with autoimmunity and healing that gut lining and looking at the microbiome. And then the environmental triggers one is the one that is like a very wide category. So that's going to include toxins. That's going to include like your molds, pesticides, heavy metals, BPA, all the junk that's in our water supply, in our air quality, any sorts of infections. So sometimes we can find, let's say, a parasite that's causing like a reactive arthritis in somebody. That's it. It's like that was the big thing in your gut that was causing your rheumatoid arthritis. So Really important to look at any of those infections. Any sort of diet and lifestyle choices, right? Nutrition, exercise, nutrient deficiencies, chronic trauma, and stress are also huge too. So research suggests that about 80% of people who develop autoimmune diseases report significant emotional stress right before their diagnosis. And when it comes to the trauma piece, this is really, really important. People who have the more childhood adverse experiences that you have had, so that's like when you're a kid and you've experienced sexual abuse, emotional abuse, physical abuse, neglect, just general household dysfunction, the more of those you've experienced, the more likelihood you develop an autoimmune disease or lung disease, heart disease, cancer, diabetes, and other things. So
Can you describe like how that is actually the trigger point? Because this is something I talk to my clients over and over and over again. If we do diet, supplementation, sleep hygiene, exercise, we can do all of that stuff and we could do it perfectly. But if we don't address the nervous system, that's like your Achilles heel. So can you kind of just like almost like reverse engineer that and explain to the listeners, how does that determine everything else going on in your health? Like, how does that create that cascade?
Yeah. So, well, from the trauma piece, like when you experience trauma, your body is trying to protect itself. Even if it's a mental emotional trauma, your body doesn't know the difference between someone physically like beating you or trying to hurt you and someone screaming at you, right? Or some sort of other emotional thing happening in your life. So when our body's trying to protect itself, it's going to go into a fight or flight state or a freeze state. And any of those traumas can be, create lasting change in our bodies. It's going to create a lasting pattern. And we actually see that it increases CRP levels. I don't know if you've ever heard that, but they've looked at studies where they take just people with adulthood trauma and then people with adulthood trauma and childhood trauma. And the childhood trauma group has way higher CRP levels, just naturally, just underlying low level inflammation. So I think the best way to think about this is understanding the nervous system, like you were saying. And do you use the polyvagal theory?
I do a lot of vagus nerve activation, like the singing very loudly, the humming, the gargling. Is that what you're referring to?
Those are the tools. So the polyvagal theory is just the understanding of like how the nervous system is organized, basically. Back in the day, we just thought that we had two sides of the nervous system, and now we look at it a little bit differently. So you have your ventral vagal state, which is like your parasympathetic. This is your rest and digest state. This is where you feel calm, safe, connected. This is where your body is like a well-oiled machine. Your immune system is functioning optimally. Your gut's producing enzymes. You're digesting your food. You're absorbing your nutrients. This is great. This is where healing occurs. Then we go into these more protective safety states, right? So we're talking about like the traumatic events, stressful events that happen throughout our days. We can go into a fight or flight state, which is where there's perceived danger. So we might feel anxiety, irritability, worried, angry. We might just feel kind of like overwhelmed. When we're here, what happens is our immune system drops. Our immune system function decreases, digestion shuts down. So think of that triggering like autoimmune issues, digestive issues, bloating, gut issues. And then all the survival stuff increases. Blood pressure, heart rate. Okay, now we're thinking high blood pressure, cardiovascular disease. And then we have another state, which is more of like the freeze or shutdown. And there's more that people talk about now, like fawn, but we'll pause at the freeze state, which is like true overwhelm. You really feel hopeless, numb, disconnected. Everything decreases. Heart rate slows down, immunity. You might feel like totally dissociated. So if you've experienced a lot of trauma, your body has gone into these states. It's a natural mechanism. It's meant to protect you. It's meant to happen. If you just experience the daily stressors of life, you've gone into these states. The issue here with our health is, if you heard about how the immune system is being suppressed in all these categories, if we're living in fight or flight most of the time, if we're living in freeze most of the time, our immune system's never going to be able to get fully regulated. Our digestive system is never going to be able to fully heal. So it's important to train the body to be more regulated. This isn't saying that we need to make you calm and peaceful 100% of the time, because that's just doesn't happen. We still need the safety cues. We still need to be able to get anxious or run away if like that's just a part of our life, right? But what we want to do is we want to teach the body how to understand how to guide the body back into ventral vagal or parasympathetic and build resiliency in the nervous system so that you can handle the daily stressors and that you can overcome your trauma triggers and things like that over time.
Yep, that was my experience. You mentioned fawning,
Mm-hmm.
and a lot of people they think that your trauma has to be like you got beaten in childhood or you have to experience some kind of sexual trauma. Sometimes it doesn't look like that. Like simple neglect or certain things that were said to you, like constant criticism
Mm-hmm.
and not getting that support or having a parent that's misattuned, when you are asking for help and you are made to feel like you're stupid for asking for help, or
Mm-hmm.
are upset about something and you're told to shut up. It's like that misattunement sets the stage for you becoming a people pleaser. And when you become a people pleaser, you are essentially prioritizing the feelings and emotions and needs of everybody else in your external environment. And that is required to be normal and peaceful in order for you to feel at peace. So if you're
Mm-hmm.
constantly having somebody in your environment that's in a constant crisis, maybe you're in a toxic environment or a toxic relationship, maybe you have a very miserable parent and you constantly are trying to appease that person, you are going to be in a constantly dysregulated state, hypervigilant state, because your primary goal in order for you to feel okay is to make sure that they're okay. But you can't do that. That's not your responsibility.
Mm-hmm.
That's something that I teach a lot in my coaching, and that is the foundation of it all, is learning how to recognize those beliefs that you took on from childhood, because most of what we do and most of what we think is a personality trait is really programming that we took on from when we were
Mm-hmm.
really little kids, the things that our parents repeatedly said to us or to the people around us, and we took that as fact. So we need to challenge those things. So I have this very prodding self-concept worksheet that I give my clients right at the beginning, because it's something that you have to work on throughout the entire process. It's not something that you just journal about one day. It's like, okay, we need to integrate now. We need to identify what the stressors are, what the belief
Mm-hmm.
systems are that are causing you to be in that, those lower vibrational states that are causing you to be in ill health. And that's another element too, is the visualization. I don't know if you teach this in your practice or not, but a lot of people
Mm-hmm.
that have autoimmune conditions, they start to take on that belief that their body's broken and that they
Mm-hmm.
can't heal. That is going to be the biggest number one block for you. Because if you can't believe it, you can't see it, you can't even visualize yourself being in good health, it's never going to happen.
Mm-hmm.
Everything is initiated within the mind, and then the belief comes first and then the actions follow. And then that's when you will witness that change. Is there any like specific tools or types of therapy or techniques that you always revert back to for your clients that are suffering with autoimmune conditions and it's basically caused by a trauma response? Is there anything that you really go back to?
Well, first of all, just to follow up with your mindset piece, so key. I love talking about the placebo versus the nocebo effect to give people an idea scientifically of how they can view this, instead of just me saying like, your mindset matters, right? It's like, no, we know that the placebo effect is real, where I give you a pill, I tell you that your headache's going to go away with it, and you believe it, right? And then your headache goes away. Magic. It's in studies. We see it all the time. The nocebo effect is the one that's not talked about enough, which is if I give you this pill and you believe it's going to make you nauseous or give you a headache, the likelihood of that happening has significantly increased. And so it's one that's important as you're going through your protocols and your healing. You must truly believe in your practitioner, truly believe in what you're doing, believe in your ability to heal, combined with, not identifying with being sick, not saying that I have this autoimmune disease, this is it, this is the rest of my life. And I really dislike those pages on social media that are like promoting the chronic illness stuff. I think they have really great hearts, right? They don't know any different, but when we're constantly identifying with that all the time, it is locking ourselves in that container. And the visualization piece too. It's like Olympic athletes use visualization to win. It's just visualizing the person that you are becoming, want to become. And I've seen it work in real time. Like I've taken clients through it who have had chronic pain, and then taking them through a visualization of getting rid of that pain, 10 minutes. And they're like, wow, my pain did actually just go away. I need to do that more. It's like, yeah, you're that
Hmm.
powerful. You really are.
Yeah. Yeah. And being
So
connected with the breath.
to answer your question, so with any trauma, nervous system dysregulation, it's important to recreate safety in the body and retrain the nervous system. So there's a million vagus nerve tools out there. I think starting really small is important. Something like VU breathing, which is basically just a different way of like humming or chanting, right? It's just that and repeating that over and over again. I also really like eye movement techniques. There's some pretty simple eye movement techniques because the vagus nerve is connected to the eyes. And I can tell pretty quickly when I use these with clients how dysregulated they are because of their reaction to the eye movements. Some people, we do one small eye movement and they're like, whoa, overstimulated, can't handle that, eyes hurt, versus somebody who, can do it with hang with me for the full couple minutes. It says a lot about where they're at.
I've never done this. You need to demo this because I've never heard about the eye movement thing. So I want to know more about this. Go in on it.
1, 2, 3. There's 4 or 5 different ones that I use. So I won't go through all of them. Some of them are moving your head in different directions and your eyes in different directions and holding. And then some of them are even more simple. So like the simplest one we can do is a spotting technique where you just take your thumb and put it in front of you. Let me see if I can get in the camera. And then you stare at your thumb and you just keep the focus there and you turn your head side to side. And you just turn it. Now, some people will only be able to turn their head a tiny bit because they need to work up to it. Some people can do this pretty easily. So you do
Is
that
that
about
healthy?
10, you could do that about 10 times, take a 30-second break, do another 10, 30-second break, another 10. There's also the figure 8, which is like tracing your thumb or making a figure 8 with your thumb and then following it with your eyes and going in both directions. That's another like small starter one that people can do.
I wonder how many people have failed a DUI test because they just had vagus nerve dysregulation.
I have not thought about that.
You're like, I'm sober right now. What are you talking about? They just got to have they just had trauma.
Yeah,
Be
that's
terrible.
funny. That's funny. So those are some small ones, and there's a lot of other tools, but I usually have clients practice like something small for a few weeks and kind of see what's working. And sometimes you're not going to notice this big jump, but you want to start to notice, oh, I'm responding differently to things. I'm feeling more resilient over time as you practice these. When it comes to emotional stuff, I really love tapping, the emotional freedom technique. I do walk clients through that. But at the end of the day, I'm not a therapist. So if someone has some deep, deep trauma, like we can talk through some things, but usually I recommend something like EMDR therapy, internal family systems, somatic experiencing is something that, could be done on your own. But EMDR, I feel like has been really powerful for me.
Yeah, I haven't tried the EMDR yet. I went the somatic experiencing route just based off of my own personal trauma. That one aligned with me the most. EMDR is not going to
Mm-hmm.
work for everybody. EMDR is really good for people that experience like a traumatic event, like you have
Right.
PTSD.
Yeah.
But if it's like a recurrent thing, like you had a very toxic parent, maybe you had a narcissistic parent that was very abusive to you emotionally, and you've ended up like kind of accruing a lot of stored stagnant energy in your body. The somatic experiencing is amazing. Just like rocking the hips and just literally like connecting with your body and telling yourself that I'm safe in this moment. I'm present in this moment. I don't have to be everywhere else in my mind. And that's
Mm-hmm.
where a lot of people benefit a lot from the somatic experiencing over these other types of therapies, especially over talk therapy. I think we all are starting to recognize just how redundant and not helpful it really is. I mean, it's very difficult to find a counselor or a therapist that is in that realm that can actually move the needle on your healing, because they can't do any type of energy work. That's not what they're doing. They're not removing and releasing that stuck and stagnant energy. They're not really
Mhm.
working on belief systems too much either. You're kind of just talking about your feelings and, taking the Band-Aid off and then just letting it bleed again. And just for it to,
Mhm.
you know what I'm saying? Like, we're not actually initiating true healing and integration. So that's something I've experienced myself. I was in therapy for years, and I would still have these, I would get crazy cystic breakouts. And it was
Mm.
because I was suppressing my emotions. I was in a toxic relationship. I felt
Mhm.
scared to, talk about my true feelings because I was terrified of the reaction. Because in my past, when I spoke my true feelings and I tried to come across in the nicest, calmest manner ever, that person tried to destroy my life. So
Mhm.
you have to consider these things that you've either been through in your childhood or your adult life. Like, those things can impact your future relationships and your current health. Like, sometimes your skin issue has nothing to do with the food that you're eating, and it has everything to do with your emotions and your
Mhm.
stress state. Have you noticed a lot of your autoimmune clients, do they tend to have skin issues as well? And did you notice any of that clearing up as you were doing the nervous system work?
Mm. It's a good question. Sometimes they have skin issues. I wouldn't say that's a prevalent thing. I mean, obviously if it's like psoriasis, but people have, yeah, I mean, people definitely have like some acne, and then that will clear up with the work. It is interesting to think about it related to the nervous system, but it is. Yeah, and the somatic stuff is so important, like learning how to express your emotions. I do somatic breath work with clients as well. I'm certified in somatic breath work, so that is very profound for people, where they just get releases and they're like, interesting, I don't even know why I was crying. And I'm like, you don't need to know why you're crying. It was just some energy that was in your body that you've been holding on to for who knows how many years. You got to let yourself feel and move through that stuff. But yeah, there can absolutely be those connections between the skin or any sorts of symptoms and your emotions and your nervous system.
Yeah, you know what? One study this just popped up in my head would be so cool. You've seen that. I don't know if he was a doctor or a scientist, but he basically froze the water and saw
Hmm.
like the structure change based on like whatever like was spoken to it. I wonder
Right.
if they crystallize like a tear from an emotional release, if that would show like an image or something, because it's energy being
Hmm.
moved from the body. It's like an excretory or detox pathway. It's crazy.
Right.
That is, I don't know. So that just triggered a thought. I just had to say it. But I want to ask more about your programs and maybe some of the things that you've incorporated into their plans. Like, what are some of the herbs that you tend to utilize when you are treating your clients with autoimmune conditions? Is there like a few staples, or is it pretty custom to them?
I would say it's pretty custom. Um, I mean, usually there are some staples like a really good high quality fish oil. I don't see my clients usually eating enough omegas in their diet. So a really good high quality fish oil also supports their inflammation. While they're healing, a really good high quality multivitamin or B complex, mineral complex, really depends on their testing and what's on the results. And then, yes, everything is okay. What kind of infections are we dealing with? What type of mold are we dealing with? Because we might need to use different binders or different antimicrobials, antifungals to support them. But sometimes I would say just like generalized things that could be for people with autoimmunity. This is not medical advice, but
Always got to say it.
vitamin vitamin D plus K. Oh my gosh. There was this study that came out this year about multiple sclerosis and vitamin D. And it was something along the lines of a certain amount of vitamin D. I'm going to butcher this as I don't remember the study off the top of my head. Certain amount of vitamin D, and it stopped the progression of the MS, and there were no other interventions. It was literally just vitamin D. And these clients come in, and I would say 90% of my clients have extremely low vitamin D. So, yes, we want to get that from the sun. And because of our modern world and lifestyle, a lot of people still will benefit from and need that vitamin D with K2. The fish oil, a lot of autoimmune people are just super inflamed. So maybe something like a super high quality turmeric or other anti-inflammatory agent just to help them until their body heals. Those are a few that I'll recommend for now.
Beautiful. Yeah, I really like I don't know if you've heard of Dr. Amy
Hmm.
MD. She has a line, and she's got a liposomal turmeric curcumin
Hmm.
supplement, and I notice like a instant difference when I take that one.
Nice.
So, yeah, I really like using that one for my clients as well that have a lot of inflammation.
Hmm.
I like using nettles. Have you ever used nettles to like suppress any like if they have an overlap between like autoimmune and histamine? That one is so good at calming the mast cells.
Yes, for that specifically.
Yep,
Yeah, for any
yep,
of those
yep. So yeah,
allergy-like symptoms.
but yeah, so like you said, it always is going to be case dependent, and that's why we do what we do. And we will never give a protocol and just send you on your way because there's got to be an ongoing dialogue. You know what I mean? If you have a bunch of different symptoms from a bunch of different inputs, say you have the trauma layered on with, the leaky gut, and then you have the nutrient deficiency, and you take maybe you take like a B vitamin complex, and then you get nauseous that day. Like, you need to have that interaction with your practitioner to make sure that you are taking them appropriately, number one. And then
Hmm.
also, we never know how sensitive you're going to be. Like, some people are extremely sensitive, and we need to do like 1/4 of the dose of what we normally would. Or maybe there
Hmm.
is an MTHFR genetic polymorphism that we weren't aware of. And so we need to have a specific supplement for that. I pretty much always across the board with my clients, that's always suspected. So I'll never like even utilize a product that could possibly be triggering to MTHFR
Hmm.
just to, cover the basis. Cause like, why would I, you know what I mean? Like, why not use the most bioavailable form of that product as well?
Right.
So
Yeah, going slow is super important. Titrating things in, taking baby steps, and making sure that you're not having a reaction. Just because I just said something about turmeric on this podcast does not mean that your body is going to react well to turmeric. So we always got to check these things and remember that you're a extremely unique, one of a kind human being. And this is where the testing is important.
what,
And I don't know about you, but you don't use Cellcore, do you? Or do
not
you?
anymore, not
Okay.
anymore. I used to previously, but now mostly I use like Designs for Health, Quicksilver Scientific.
Okay.
Those are usually like my go-tos. What's your stink about Cellcore? Now I'm curious.
I don't want to call them out specifically. Yeah. I just have beef with supplement bundles, forcing every client to go through, and maybe that's not how you used them, but forcing every client to say, you must go through phase 1, phase 2, phase 3, phase 4. And I'm like, hey, that might not be what you need. We need to totally scrap all of that and just start with what's best for your body based upon your labs and not get you into this supplement bundle that I have heard stories of some people not reacting the best to. I actually never really used it, but
Yeah, when I first started off, I started running people through parasite cleanses, and that's when I
mhm,
was using Cellcore the most, but I had never used any of the bundles. I'd always done a pretty lengthy screening process to see like where their reactions were coming from. Like, are they very histamine reactive? Did they get exposed to
mhm,
mold? Like, why are the
yeah,
parasites here? Like, why are we actually doing this?
right,
And more often than not, I would have to incorporate other supplements from another brand, and it wouldn't just be standalone Cellcore because they don't really have much for like leaky gut. It's all
right,
it's like elimination. It's not
mhm,
healing and recovery. And I mean, they do have like the CT minerals, which is good, but I rarely ever use them anymore, if at all. I can't even remember the last time I ordered anything from there. Um, because there's just so much other stuff. I don't know if you use Emerson, but I use Emerson for my practice or full script.
mhm,
Yeah, same difference.
gotcha,
Emerson has a little bit more.
okay,
It's like a sister company, but yeah, all high quality supplements on that website. So that's why I always kind of refer to that one.
mhm,
And there's always multiple options for everything too. Yeah, you got to be careful when you are taking supplement recommendations online. And this is kind of why I've never partnered with a specific brand, because like when you go to promote something like that, people just think that, oh, I have XYZ symptom, this is going to help me. Well, it might not. You might
Mhm.
react very badly to that supplement actually, because like I was saying, you might have a genetic polymorphism or you're just not in the right state yet. You need to do a rigorous repair phase first. That's always got to be the
Mhm.
start, is like if you're showing any sign of leaky gut or histamine sensitivity like MCAS, you can't skip over those steps. Or if you start to push bile, you start to do kidney, liver, gallbladder cleansing, like you're going to not have a good time. It's going to be a miserable thing. And that's why I always err on the side of caution whenever people ask me about, oh, should I try this parasite protocol or this parasite cleanse, like the Parafy cleanse or
Mhm.
whatever. I'm like, probably not. Like, with where you're at, like, I don't ever want to give somebody vague or generalized advice like, oh, yeah, you could try it. I always say no.
Yeah.
And then always try to make sure that they're aware that, like, okay, there's a reason why she's telling me no, not just because she wants me to sign up with her coaching program, which a lot of people, I don't know. It's hard to get that point across sometimes, like trying to explain like the reason why I don't just order labs by themselves, because I talk about lab testing a lot on my page. And I talk about the functional labs, and everybody's always like, where do I order these labs from? And it's like, I like, even if you ordered them with me, I wouldn't just order the labs for you, because number one, how are you going to interpret that? And
Mhm.
then, you know what I mean? Like, I'm going to run these labs for you, and then you're going to want me to give you some recommendations based off of that. Number one, that takes a lot of time and
Yeah.
consideration for me, because I'm going to want to make sure that there's no contraindications. Like, where are you at currently? So I would need to have you complete my intake process first and foremost anyway, to even give you a recommendation. So it's like, I don't mess with like individual lab testing. If you want to get individual labs done, go to a naturopathic doctor and don't get the result that you want, because they're not going to be able to sit with you and actually
Yeah.
explain the why behind those levels. You know what I mean? They're just going to run the test and then charge you $300 per 30-minute appointment every
Mhm.
time. And you're not going to get the result you want. Like, I've literally had that conversation the other day with somebody that was interested in coaching with me. She would get charged $300 every call, and she's still in the same position that she was in on a slew of supplements,
Mhm.
supplements, and did her naturopathic doctor said that she confirmed candida but never ran any testing, and then immediately went to antimicrobials for that candida.
Mm. That's
No
great.
nervous system guidance, no leaky gut repair. Like,
Yeah.
it's tricky out there for
Mhm.
people to find the right information and to trust the right person, because a lot of people have gone to somebody that they thought was an expert, and here they are stuck in
Yep.
the same spot.
Mhm.
So,
Actually
yeah.
just made a video about this, I think, like, yesterday or the day before, about it was, like, 5 mistakes, 5 red flags, you should look out for in your functional medicine/naturopathic practitioner.
Ooh.
Mhm.
What are those,
I'm trying to
if you
remember,
don't mind sharing?
like, what are the 5 that I put? Well, one of them was about the nervous system. Right? If you're not regulating your nervous system, you take all the supplements in the world, but that's not going to do what you want it to do. One of them was a drainage first approach, making sure that your detox pathways are actually open before you start any sort of crazy protocols. One was they just try to, well, I guess the red flag is they don't do that, right? They don't tell you should open your drainage pathways. They don't work on your nervous system. One of them was they just give you like a nutrition handout and a big supplement list, right? No support, no guidance, none of the other principles. They only tell you that you just need a gut test and a food sensitivity test. I know you totally agree with that one.
Yeah. We're
I
on
hear
the same
I
page with the food sensitivities.
Yeah. And I think the last one was they only give you supplement bundles and nothing like truly customized. I think those were the 5.
Mhm. Mhm. Yeah, that's so real. That's so real, and that's why people feel stuck, because like you said at the beginning, we're all very unique. We all have very bio-individual needs. And that is coming from, our genetic predispositions, how our family line evolved over time, what was available in the areas. I have a unique opinion about blue zones, and I don't think it's because they're mainly plant-based. I don't think that at all, actually. I think that they are eating their natural diet with what's available to them, and they've become accustomed to those foods. They have a strong community. They don't abandon their elderly, and they have a minimal pesticide use and environmental toxins in those areas. And the stress is overall lower. So it's not just like, it frustrates
I
me so
totally agree.
much. Yeah, like the articles that they're making, it confuses people because they're like, oh, well, these areas, and they made this article and they said that they're majority plant-based, then so it must be that plants are the healthiest thing to eat and I should go vegan. Not the case.
No, no.
Spit your opinions on that.
I mean, I completely agree with everything you just said, first of all. I think what happens when people experience profound effects from all of a sudden going totally vegan or totally carnivore, like these really extreme diets, is they're not really focusing on other parts of their life. So now they went from a standard American diet, seed oils, sugars, packaged processed foods, stuff that's truly inflaming your body, to vegan, where they're probably eating a lot of produce, like pretty healthy stuff. I mean, there is a bad vegan diet, but they're probably eating a lot more healthier stuff. Or carnivore, same thing. Like they're cutting everything out. It's just like animal protein. Okay, now you don't have any sugars. You don't have a lot of these inflammatory foods. Yes, your body is going to feel a lot better, right, than the sad diet. So I think that is what happens initially. But if we go all the way carnivore, well, what about your gut microbiome? What about prebiotic fibers and probiotic foods? What about polyphenols and antioxidants and different nutrients from different plant-based foods? If we're only doing plant-based, what about carnitine? What about B12? What about all of the amazing amino acids, bioavailable amino acids coming from animal protein? So I believe that we're meant to eat a much more diverse diet. And although in my practice, I do teach people more of a anti-inflammatory elimination style diet for a few months because they're so sick, I don't believe that that's something they need to stick to for the rest of their life. I believe that when you like community, play, stress relief, sunshine, sleep, exercise, like those are the things that will really, really move the needle. And then nutrition is just like a small slice of the pie.
Yeah, I really like what you said about that. Like they jump right to the extreme of it. They're like, okay, I need to do this diet because they hear all this content where they're like, it's my diet that's wrong. I need to eliminate all of these food groups without addressing the foundations, like the fact that they are probably not getting any sunlight or like very little, or they're not getting it at an appropriate time. And then their circadian rhythm ends up getting thrown off at night. So then their sleep is thrown off and their recovery is poor. And it's just, there's a lot going on in the very simple things. Like our lifestyle has become so abnormal, but we've normalized it. You know what I mean? Like just the staying up late, the alcohol being infused into every type of social event. It's tough to get people to overcome what we have normalized as a society. Like getting back to the basics is, like you said, is what's really going to move the needle, not just some, extreme diet. And like over time, it ends up backfiring. Like, yes, you will feel good at the beginning. I had my little experiment with a vegan diet. I experimented with carnivore diet, but it's not a long-term solution. Like, I think there's a time and place for all of them. Sometimes people need to go on a little bit more of a plant-focused diet for a period of time because maybe they've created a bottleneck in their liver detoxification. Maybe they have supported phase 1, but not enough of phase 2 and 3. So maybe it would be a good idea to increase the plants and decrease the saturated fats for a short period of time so that you can support that phase. So there's a lot of nuance to it. And that's why we always encourage you all who are listening that if you're struggling with your health right now, like the best thing that you could do is hire somebody that knows more than you. Any coach in the world that is successful has had a coach or a mentor themselves. They
Mhm.
read books, they get higher education, they go to school, they look to higher wisdom. Okay. Do the same for yourself. Unless you want to continue on that cycle of trial and error and you want to put in 10,000 hours of work like me and Rachel have in order to heal ourselves, then go for it. But if you want to focus on your family and your career and you don't want to spend the time researching, then hire somebody that knows what to do and that can guide you through a process that only takes 3 or 6 months. And then your health journey won't be a 10-year problem. You know what I'm saying? Like I wish
Yeah.
I would have known about FDN before, but I found out
Same.
a little bit late and I had to go through that trial and error process. And once I went to FDN school, I was like, light bulb, this is
Mhm.
amazing. Like this is exactly what I needed. And I had never heard about like nervous system and stress and emotional suppression before that.
Mhm.
Obviously, I did some further education because they don't teach you a whole ton about it. It's kind of wave tops.
Yeah.
But it was a point that I had never really even investigated for myself.
Mhm. I
Yep.
agree.
Yeah.
Yeah.
Well, all
I
right.
I I always tell people like everything that when I first started healing my body, I had to go to many different practitioners. I was using functional practitioners and acupuncturists and all these people, but they were giving me like a 16th of what I needed. And so I
Mhm.
was like, okay, I'm pasting all of this stuff together and like creating this puzzle. And now I know exactly what it took. So it's like you could come here and we can do all of it together. This is why we cast such a wide net on what we focus on, because it truly is holistic lifestyle that matters to move the needle.
Everything. Like there's so many inputs that we have. You know, we have the environmental toxins, especially women, you know, with like the hair care, the makeup, the body care, the perfumes, like that's so much input, such a toxic load that's being placed on your liver that we're not even aware of, you know, even
Mhm.
down to our clothing, you know, like the polyester. Now we have that as an input, you know what I mean?
Mhm.
And there's just a lot that we are exposed to on a daily basis that ends up building up in the body. And then one day, you know, we turn 35, 40, and we say, oh, it's because we're old now. No, it's because you had 4 decades of toxic shit building up in your body and
Mhm.
4 decades of just being completely dysregulated because you never considered that. And you thought that since you were pushing through and that you're still functioning, that you're okay. The rubber band's eventually going to snap. Like we talk about
Mhm.
this in FDN, adaptive reserve, right? You only have
Mhm.
so much until you reach a point where you reach organ failure. You know what I mean? Okay, well, there
Mhm.
might be a day where a doctor is going to be asking to remove your gallbladder. You don't want that. Do the gallbladder flushes and the cleanses beforehand with a coach, with oversight. Do it the right way, do it in the right phases, and you won't need to be met with that one day. You won't
Mhm.
need the ER visit. So, yeah, I'll get off my soapbox. Well, I appreciate you being on today, Rachel. I'm sorry that we went over time just a little bit, but before I let you go, I do want to let the listeners know where to find you. And I think you mentioned that you have a special offer.
Yes. We need to discuss what that is.
Yes.
Um, my channel is Natural Health Rising everywhere, naturalhealthrising.com. TikTok is where I have most content, post the most. I have a YouTube channel, Instagram. So reach out to me on any of those platforms. Go look at all my content. There's lots of fun guides and freebies and webinars and all sorts of stuff that you can go access for free. And then yes, what I wanted to mention today, two things. Of course, they can book a consult if they want to chat with me to work one-on-one for lab testing and all the deep analysis that we talked about today. But I did come out with a new mini course. It is called the Autoimmune Reset, and it is over 5 hours of content of nutrition education and gut education and drainage support, like kind of the places that we've talked about, like where do you actually need to start and what really starts to move the needle. And so before you dive into something, it's for people who want something self-paced and something that's super affordable. So I'm going to give you a code. We'll figure out what that is, and you'll get a special discount just for this podcast only. So Miranda will put that in the show notes.
Amazing. Yes, I'll keep everything there in the caption. I'll link all of Rachel's social media platforms down in the caption below so you can easily find her and myself. And yeah, I just want to thank you again for being on. I thought this was an amazing conversation, and I look forward to maybe having you on again one day.
Thank you so much for having me. This was fun.
Awesome. All right, you guys, thanks for tuning in, and we'll see you on the next one. Okay. All right. So the last time that I stopped it, it just like exited out, and I just want to be able to like say goodbye. So I'll trim the end of it or whatever off. So what I will do
If you stop it, if you press leave, usually it'll stop it, but that's okay.
No, I mean, like, do you use Riverside too?
Mm-hmm.
Oh, okay.
There should
Because the
be a
last
stop.
time that I hit stop button, it literally exited out. Sometimes it's glitchy. You notice that?
Okay. Yeah.
Maybe it's just on my end.
I used it for a while and then it was messing up all my podcasts. And then I stopped using it for a long time. And then recently I've gone back to it just because the quality is really good. So I'm like, "Ugh, I was hoping that it's improved the bugs since I used it.
Yeah, I think there was a bug on the last one that I did because like throughout the whole recording, like there's a weird noise and I had to keep like turning off my mic, and I'm like, what the heck is going on? So it pretty much ruined the whole podcast. And then on that same one, I hit stop and it completely like just exited out. And I was like, what the freak? Yeah, I'm glad that you said that too, because I'm like, am I just using this platform wrong? Because it's like not what I was hoping for.
Right.
Yeah. Okay. I'll just have you
What code
go
would you
ahead.
like? Do you have like a code that you want?
I did email you back. I emailed you back a
Oh, you
little late
did?
because I was working this morning.
Okay.
So just wildly thriving works. If you want to add like whatever the discount is, like 15 or something,
Yeah.
you can put that on the end. Doesn't matter. But just email me back like the link to your TikTok, your Instagram. If you haven't done this already, my assistant does all this, all of your platforms, and then your website. And then I will put the discount code there right below whatever your offer is. Okay.
Sounds good.
All right, cool.
Perfect.
And then once the export is ready, we'll email it to you within the next couple days or so. She's going through a typhoon right now. So
Is she like in the Philippines or something?
she
Yeah.
is. Yeah, she's in the Philippines. She's awesome. But she's dealing with that today. So if she can today, then yes. But if not, then probably Monday you'll receive the export and you can edit it however you want. Just don't make me look bad. And then just tag me in the page. If you want to collaborate on something, then you can do that as well too.
Okay. Sounds good.
All right, cool. All right, awesome.
Amazing. By the way, I was browsing on your page today and I saw that you use peptides too.
Mm-hmm.
Cool. Do you get them where do you get your peptides? I just started using them. So just curious.
I know people have like a weird stink about the research chemicals, and I get that, and that's totally valid.
Mm-hmm.
And it's the only reason that peptide manufacturers have to say that is because there's only like 2 or 3 compounding pharmacies in the States that are allowed to say that they're like FDA approved and like they have a doctor overseeing it and everything. So that's the reason why they have to label it that. But the source that I get them from, third party test it. And so they're 99.9% purity. I can't say that for all of them. If it's research chemicals and we don't know if they third party test, then it could be like not good. You know what I mean? But I use Mission Critical. So if you want to, do you want me to connect you with the guy that owns it? Like I trust him with everything. Like he's been curing people of fucking cancer.
Really?
I'm not kidding you. Like
actually,
severe illnesses.
That's insane. There are a couple peptides I'm curious about that I don't have access to, but what you might find interesting, because you don't get any, like if you recommend peptides to your clients, you don't get anything from Mission Critical.
Wait,
do you recommend peptides to your clients?
Yeah, like I incorporate them into their plans. I have my disclaimer, but
okay,
I say this is for educational purposes, but you could use these if you want.
Which ones are you commonly recommending to them?
BPC is always a base.
BPC.
If they have any type of injuries, TB 500, I'll pair with that. MOTS-C for anybody that's recovering from mold, from like energy issues, fatigue. Kisspeptin, people in perimenopause. If they're having any type of, if they have like low luteinizing hormone or LH to FSH balance. We'll do kisspeptin. I really like Selank for people that
Mm.
are stuck in fight or flight. That works on the GABA receptor.
Mm-hmm.
So it's very calming without being like drowsy, you know?
Yeah.
Selank is really good. People that have ADHD, C-Max, that's a good
Mm-hmm.
Adderall replacement. If you have I haven't really recommended this one too much. I've been experimenting with it lately, but dihexa for memory issues after stressful events or mold exposure. So like if they do a protocol with you and they still are like my mind isn't like foggy anymore, but I feel like my memory sucks, dihexa will repair that. What else? GHKCU for people that have like hair, skin, like more like beauty related
Beauty stuff.
stuff.
Yeah.
What other ones? No, there's a few more.
Hmm.
AOD 9604 if they are individuals that can't handle the hormone secretagogues like CJC 1295 and ipamorelin. I like that one for fat loss and lowering
Mm-hmm.
inflammation. If they have high leptin levels, AOD 9604 will lower that. So it helps with
Mm-hmm.
chronic pain
Mm-hmm.
and fat metabolism and energy. 5-amino 1MQ, I like for fat loss and healthy energy.
You're a
It's
lot.
like
You're
I love it. If you want to chat about peptides anytime, I'm down.
yeah.
I really like the peptides. What ones have you been using or looking into?
I just started microdosing tirzepatide, and I have GHK copper, and I know NAD is not a peptide, but I also have some NAD. I injected that today for my first time, and I'm like, I don't know if I really felt much, but
How much? How much did you do?
I oh, what is it? It was 20 units, which was how many milligrams? 40 milligrams?
Oh yeah, that's not gonna do a lot.
40
You need to
milligrams three
do
times per week.
Yeah, you need to do like 250 to 500. It's expensive, but like to really feel it, like you're gonna need to do 250 to 500 per dose.
Wow, interesting. Well,
It's pricey. That's why I like Mont
something
C better.
really?
I like Mont C better than NAD because it's more cost effective and it works on like the framework of the mitochondria. And you
Mhm.
you and I both know that like if you target mitochondria, everything else will have a cascading effect,
Mhm.
right? Because it's in control of every system in your body essentially. So I like Mont C preferred over NAD just from a cost standpoint as well. And I feel like it's I don't know. I feel like it's fixing the actual process itself instead of just like supplementing on top of it. You know what I mean?
Yeah, yeah. Yeah, yeah.
Yeah.
Cool. I'm gonna look into this company and all of that. I partnered with this platform recently that you can sign up and then you get affiliate commission, and they have like a board of doctors. Yeah, they're all like compounded and prescribed. So I
It's gonna
just
be
started.
expensive as fuck.
Yeah, that's what I think I'm realizing. One of my clients who ordered BPC 157, she's like, my friend said that this should be a quarter of the price. And I was like, I don't know.
That's what you have to tell them because like they're paying the fees for the doctors. That's what they're doing. And the FDA and all their legal shit.
Yeah. Yeah.
Yeah. I've used over like 13 or 14 different peptides from Mission Critical. Never once had a negative reaction. And I know that he third party tests.
Hmm.
On his website isn't like fucking magnificent, but like he is so good at what he does. Like he doesn't do any ads, nothing. He's been healing like celebrities from
Hmm.
like severe chronic illness. Like he's big on the like mold for mold. VIP is really good for people that have like pulsed mold, like low immune resilience. It rebuilds
Mm.
that immune system resilience, the VIP.
Okay.
Yeah, I've been
Cool.
looking into IGF-LR3. I don't know enough about it. Yeah, he has a bunch on there. Yeah, just look up Mission Critical Wellness. And if you want to become like a practitioner with him, he can give you like a discount code
Hmm.
where you can I don't know how you go about doing it, but for instance, like for when I'm doing a about peptides or whatever, and I'm like, say this keyword, I'll add like a discount code. Like
Hmm.
they'll get 15% off their order and then I'll get the remainder. And then I'll also have one for me that like gives me like 30, 40% off, whatever. And I will be able to order the peptides myself on this end. And then I'll make that commission because I'm ordering the peptides for them. You get what I'm saying? Yeah.
Okay. Cool. Yeah, yeah. Okay.
Yeah.
You ship them to their house though, or your house? Okay.
No, directly to their house. So like what I'll do is I will get on so like for instance like my peptide protocols, I'll have somebody book a peptide consult, they'll fill out a questionnaire, I'll ask them like all of the like the contraindication questions, like make sure that they're not like acne prone or something. I don't want to put them on like CJC because they're going to break out. Um So I'll screen them and then I will create like 3 quotes for them. I'll be like, okay, this is a minimalistic stack, a moderate dose stack, and then a maximum effective stack. Which one fits your budget pretty much? And
Mm.
then they'll tell me what that is. And then I will order the peptides for them. I'll get their address. I'll mail it directly to them after they pay the invoice or whatever. I'll do like a payment link and then I'll write a protocol for them and say it's
Mhm.
for educational purposes. Big disclaimer.
Okay. Yeah.
Yeah.
Okay.
Yeah, highly
Very cool.
recommend getting into that. Definitely can really help your clients. I just wouldn't
Mhm.
suggest starting off with a majority of them. You know what I mean? You need to get like the leaky gut and everything under control. The only ones that you could start off with, I would say, are like BPC and KPV. Have you looked at KPV?
KPV is one that I've been meaning to dig into more.
Dig into KPV. That one works similar to BPC, but really helps to reduce any type of inflammation that is going on in the gut lining that is immune system related. So it could be
Mm.
really powerful for your autoimmune clients.
Yeah.
Yeah. Yeah. Would
Yeah, no,
recommend that one. KPV is good.
okay, cool. Yeah, no, a lot of them, it's like clients who have gotten through the base things that need to be done before I'm
Mhm,
like,
mhm.
yeah, they're like, "Oh, I wanna get the peptides." I'm like, "No, no, no, calm down. We need
Slow
to
your roll.
slow." Okay,
Yeah.
well,
Something. Yeah.
I have to run. I have a meeting here soon, but it was so great meeting you. Thanks for having me on,
Yeah.
and
It was great.
yeah, I'm excited to see when this comes out.
Hell yeah. I'll let you know. I'll have my assistant email you everything. Okay.
Okay, sounds good.
All right. Talk to you
All
later.
right,
Bye.
bye.